Denver will be staying home until at least May 8th. Mayor Michael Hancock is going to make that announcement tomorrow morning, and it is highly likely that other parts of the metro area will follow Denver's lead on this. So Denver and other municipalities have been talking ever since Governor Jared Polis announced that Colorado was going to be dropping its statewide stay-home order on Sunday. Aurora Mayor Mike Kaufman has said that public health leaders around the metro area have concerns about lifting the order now. Then you got down Douglas County, where Republican leaders have suggested firing their health officials when they suggested a stay-home order last month. It's not clear if they will try to fire them if they suggest an extension. Up in Weld County, they have announced that they will allow all businesses to open on Monday. Weld County's Republican commissioners have unveiled what they're calling a Safer at Work plan, a clear rebuke to the Democratic governor's Safer at Home plan. The chair of the county's Board of Commissioners, Mike Freeman, went on 310 AM radio and said that he doesn't think that the governor can stop them.
I think the governor's been pretty clear all along that his orders are unenforceable. And so he said that with his stay-at-home order. That was pretty interesting. When he gets to the end of that, he says, oh, by the way, none of this was enforceable anyway. I think he made it very clear that he expected local health departments and local counties to figure this out, and they would be the ones enforcing it.
Weld County has been particularly hard hit by COVID-19. They currently have 1,263 confirmed cases and 70 deaths. Only Denver and Arapahoe counties have more. Late tonight, a spokesman for the governor told me that counties that are out of compliance with public health orders risk losing state emergency preparedness grants.
After health officials linked several cases and a few deaths to the store. The Tri-County Health Department says a worker for a security company, a Walmart employee, and her husband all died. All were in their 60s and 70s. 6 other employees tested positive. The department ordered the store to close this afternoon after it received complaints from workers and shoppers about a lack of social distancing from too many people in the store and workers not wearing masks. That 11,000 confirmed cases exist in our state. 873 people are in the hospital as of the latest data, and there have been more than 2,200 total hospitalizations. There are 552 confirmed deaths. That's the largest single-day increase so far, but the numbers are delayed, remember that. And as our 9 Wants to Know team found, the number of deaths is likely much higher. Back in February, the public health officials whose jobs are to determine how someone died knew very little about novel coronavirus.
That there are likely cases due to COVID-19 that they simply missed. Here's 9 News reporter Kevin Vaughn.
It's become a regular sight.
Thanks everyone for being here.
Governor Jared Polis
reporting the latest numbers,
counting COVID-19's rising death toll.
We have 19 deaths, 300 deaths, 348 deaths, 449 deaths.
But as horrifying as those numbers are,
I have no definite proof of this.
9 Wants to Know found the real death toll is almost certainly higher.
I firmly believe that there have been a number of deaths that were at least linked to COVID-19 that will never be attributed to COVID-19.
And here's why Dr. Mark Johnson of Jefferson County Public Health thinks so.
It can look like heart disease. It can look like a neurological disease. It can look like gastrointestinal disease, and it can look like respiratory disease.
Of all of our natural deaths, of all the ones that presented with pneumonia and coughing and fevers.
So do coroners like Jill Roman in Douglas County.
Back in the day, we probably missed them all.
I do think that's quite possible.
Ditto the state's epidemiologist, Dr. Rachel Herlihy.
I think the question, though, is how many?
There are no hard numbers at this point, but there have been suspicious cases.
And I performed an autopsy on this gentleman.
For Arapahoe County Coroner Dr. Kelly Lear, it was the death of a man in his 40s in early February.
He showed all the symptoms and had very severe lung disease that looks at autopsy like what we are hearing COVID-19 autopsy lungs look like.
That's what she knows now, but back then, COVID-19 wasn't on her radar. After tests for flu and other viruses came back negative,
I was ready to basically sign his death certificate as severe lung disease due to an unknown infection.
But before she did that, the COVID-19 wave hit. She requested additional testing at the Centers for Disease Control and Prevention and waited. Today, she got her answer: negative for COVID-19.
She passed away at home.
For Gilpin County Coroner Zane Laubin, it was the death of a woman in her 50s in mid-March.
Not much medical history at all, but at autopsy, her lungs are in somewhat bad shape.
A COVID-19 test came back negative. But since those tests aren't perfect, he's awaiting other results that might provide an answer. Even so, as coroners look back at cases,
But I think there are going to be a lot of deaths, and particularly those like the ones that have been cremated, where it will never be able to go back and find out.
still, there are good reasons to try.
From a scientific point of view, we're always searching for how close can we get to the truth.
Accuracy is what's important.
It behooves us to go back and look at our prior cases.
We need the information, we need the data to answer questions about who is most at risk. So understanding what age groups are most at risk, whether we're seeing health disparities by race and ethnicity.
The whole purpose of this is to prevent additional loss of life.
Kevin Vaughn, 9 News.
The Colorado Department of Public Health and Environment says that it is going to start counting these probable COVID-19 cases in the coming days. So these are cases where there never was a test, but the symptoms match COVID-19 or what they're calling an equivalent condition. They think that these additional cases could add 130 deaths to Colorado's totals. That story is part of a broader project, a statewide reporting project called Colorado's COVID Diaries. More than 40 news outlets from around the state have teamed up to report about one day in our battle against the virus. CoLab's stories will be released on Sunday on 9news.com.
The Coloradans to die from COVID-19 is a woman that dedicated her life to helping countless others. Jossie Eyre died on Monday. She founded the Women's Bean Project in 1989. This is a nonprofit that hires women who are chronically underemployed because of addiction and jail time. The Women's Bean Project teaches them how to work and make food like soup, snacks, baking mixes. Eyre founded it after she worked in a women's shelter, because it was working there that she realized it is one thing to keep women safe, but more importantly, they needed jobs. Even after she left the Women's Bean Project, workers say that she would still stop in and visit. Jossie Eyre was 89 years old.
Let's dive deeper into the numbers. Today marks 7 weeks since Colorado reported its first known case. Of the 552 deaths in Colorado, 59% are men. The demographics show just how deadly this can be for older Coloradans. People older than 80 account for 51% of the deaths. Patients between the ages of 60 and 79, they're 39% of the deaths. And COVID-19 continues to affect minority populations at a disproportionately high rate. Whites account for 67% of Colorado's population, yet only 53% of the cases. Hispanics are 22% of the population, but are 33% of the cases. And African Americans are 8% of the state's cases, yet only account for 4% of the population. So we've told you that the National Guard has been sent in to help with testing at Colorado's 3 largest nursing homes, places where there was no known outbreak, but that is why you test. At the Broomfield Skilled Nursing and Rehabilitation Center, they have results back from about a third of their 344 test kits, and they know that 6 residents and 1 employee have already tested positive for COVID-19. The center says that 4 out of the 6 residents didn't have any symptoms. National Guard went to that site in Broomfield along with the Pikes Peak Center in Colorado Springs and the Elms Haven Center in Thornton, because, as the governor said, these larger facilities have the potential for the largest number of deaths.
The JBS meatpacking plant in Greeley shut down after 100 workers got sick. It will reopen tomorrow. 4 employees who worked at that plant died. It's going to reopen, as we said, after the plant has been sanitized. Crystal Rodriguez hasn't decided yet if she's going to go back to work, even if the company is paying more and offering a bonus. She says she's worried about testing. JBS first said it would test all of its workers. Now the company says it will check temperatures as people get to work, and testing will only be for people who have symptoms.
The House has approved the $484 billion coronavirus aid package, which includes money for small businesses and hospitals and extended testing. Colorado's Republican congressman and head of the state Republican Party, Ken Buck, was one of 4 Republicans to vote against the package. The bill includes more than $320 billion for the Paycheck Protection Program, which is designed to help small businesses keep people on the payroll. Now, Democrats also wanted additional funding for states and local governments. New York's Alexandria Ocasio-Cortez was the only Democrat to vote no after that money was not included.
Nearly 1 in 6 workers have lost their jobs in America. The unemployment spike started 5 weeks ago with 3 million unemployment claims. Last week, another 4.4 million people filed. That's more than 26 million people since coronavirus forced the states to shut down. What's happened in the last 5 weeks erases all job gains since the Great Depression. Colorado added another 67,000 claims last week. That's 279,000 total for the last month. Those numbers do not include self-employed and gig workers who could start applying this week. The State Department of Labor says more than 30,000 of them have filed so far. We have also heard from many of you who have said you have not received your benefits this week. The state says they're aware. They say they've been overwhelmed and that the system has been backed up. The state says money that should have come in Tuesday should have gotten to people today.